Hello everyone, this is Dr. Win Tran from VietMD.net and welcome to week 8 of Medical Speaking. This week we're going to talk about gynecology and obstetrics. The specialist dealing in this field called gynecologists or obstetricians. This topic is very special in the center of patient communication for several reasons. First of all, this module, you're dealing with a very privacy and private perks of patients, in this case as a woman. Therefore, you have to be very mindful, pay attention to detail, and listen to the patients. Always, you should ask permission when you exam. You let the patient know what you're going to do, and always have somebody in the room with you. The general rule of thumb is do not examine a female patient with a private perks without anyone in the room, because this is the number one lawsuit, or it is the number one create confusions as you are a provider. Now, the body language in communication in this situation is so crucial. You have to show respect, listen, and whatever you do, the patient, remember, is the woman. She very sensitive. She can tell whether you really care or not. Often, if the patient is not come for pregnancy issues, they come for other privacy issue, they require or they like to have a doctor that good listening skill and good communication skill. The other thing is, many times a patient can come with her friends, boyfriend, or husband. In the situation, you should ask the patient to identify who it is first, and then ask patient permission to discuss in front of this person. For example, if you see Mr. John in the room with a gentleman, you should ask, "Oh, this is yours," and then she will say, "Oh, this is my husband." And then you say, "Is it okay if we discuss your case or your information in front of your husband?" And most of the time they say yes, and then you can go ahead. If they say no, then you should ask the patient what you should do. "Would you like me to excuse Mr. John out of the room and we can talk?" So that's the first thing. And remember, just like any type of communication, you have the very first few seconds to create a trust, a bonding trust between you and the patient. Therefore, eye contact, look at the patient, sit upright is so important. The one thing about gynecology and obstetrics is culture and religious play a big role. Asian women tend to be more shy and less often about their privacy issue versus Caucasian or white female. They're more open and they can discuss more freely with you. Therefore, with Asian patients, you have to be careful and go stepwise approach. Now, let's go into more detail. When you talk about history, talk about asthma history in gynecology or obstetrics patients, there are a couple key things that distinguish themselves. The first of all, you should ask or should know about patient 8. A usual past medical history and past surgical history are important. However, gynecologists and obstetric history are also crucial in order to determine what's going on. Well, let's go into detail. First of all, for obstetrics, gravidity is the number of pregnancy that ladies or women ever have. So number of pregnancy, and then parity is the number of live birth or stillbirths or delivers. Any doctor should know those two numbers, the G number and the P number. The next one you should always ask in any OB/GYN patient is last menstrual period or last menstrual days. Why? Because a lot of time in obstetrics, you estimate a gestation age based on her last period date. And a lot of time you can, in gynecology history, the last menstrual period can tell whether how long her history is, and then give you some idea about its regularities as well as heavy, normal, or light. So men's cycle last menstrual period date so important. If you don't have time, this is the thing that you must add in every visit. And then in obstetrics, there's a concept that you should know called EDD, or estimate delivery date. And this date usually estimate based on the last menstrual period. There's a software, there's a computer, there's an all-cap calculation. You should put in a number, you should come up with that EDD number. So a lot of time, the ultrasound during pregnancy can give you an estimate how, and many times the two number, the EDD by last menstrual period when ultrasound usually match. Well, and one more thing about this, this is if anything in obstetrics, the expected delivery date would be the most important piece of information when you discuss with the patient, because a lot of care, the prenatal care and postpartum care, will be based around that period. One thing about obstetrics is you also ask about previous pregnancy, because you can identify the risk, the trend, what happened with previous pregnancy. You always ask about baby history, gender, weight, stillbirth or live birth, any abnormalities when the baby was born, and then one more thing, breastfeeding or not breastfeeding. Again, this go back to religious and sometimes cultural too, because some women, they don't want to, some women they do, and you respect patient wish. When we talk about breastfeeding, maybe in a different topic, but the general rule term is the American Academy of Pediatricians recommend breastfeeding for all children is possible. Moving on to gynecology. The three things that you should ask in kind of gynecology history are age of menarche, when the patient first ever having period, because that number dictates that she reached puberty, and then how her body, how the ovary and other system worked. Then you always about the length of period. A 28-day period versus 35 days versus 20 days are significant difference and can give you some hint about the reproductive system. You should add about, if this is a middle-aged ladies, you should add about perimenopause, symptom, hot flash, fatigue, and then if this is an older woman, you should add about menopause age. Usually most people reach 50, but some are 45, some are 55, and these ages are important. Now, in gynecology, there's a mnemonic called ABCDF when you ask about issue, and one of them is age of menopause, abdominal pain, bleeding, contraception, discharge, any discharge, vaginal discharge, and incontinence, and then the fertilities. So those are the ABCDF that you should add in gynecology when patient come. So when we finish history, we move on to examination. The examination in obstetrics, gynecology are very, very sensitive. And I'd like to tell you one thing. Whenever you touch a patient, you should touch generally. Your hand ever should be clean, washed, and warm. Okay? If you have a dirty hand, don't ever touch an obstetric patient or gynecology patient. Okay? And keep it warm. If it's not warm, you can do this. Or it's really cold, you can say, oh, even my hand is warm, but my heart, no, even my hand is cold, but my heart is warm. You can tell patient those things and let them know what you're going to do next. And then always start with observation, inspection. A lot of time, the eye, the skin, the body gesture of the patient can give you some hint. Is she anxious? Is her skin normal? Does she have jaundice? Does she have edema? So give you some idea about some systemic issue going on. So when you finish inspection observation, you're moving on to palpation or touch the patient. Always tell patient what you like to do and touch superficial first, and then when the patient feel comfortable with your touch and reassurance, you can go deeper. This is so true when you perform a pelvic exam. You have to tell patient what you like to do next so she can anticipate what happened. Don't ever put in a speculum immediately or suddenly. A patient will not like it. Okay. So this is some hints for you when you communication with obstetrics and gynecologic patients. We will discuss in detail in class in particular situation, but in summary, be mindful, pay attention to detail, listen to patient, show respect, and tell patient what you like to do, and follow the stepwise approach I told you. Okay? Chào các bạn đến với tuần thứ 8 của lớp nói chuyện tiếng Anh. Tôi là bác sĩ VietMD từ tổ chức VietMD.net. Trong module này chúng ta sẽ nói về giao tiếp với bệnh nhân trong sản phụ khoa. Đây là một chủ đề rất là nhạy cảm. Bạn phải hiểu rằng người phụ nữ tìm đến bạn vì bất kỳ lý do nào, họ đều có những cái ngại và có những cái chuyện khó nói. Là một bác sĩ, bạn phải theo dõi, bạn phải hiểu và bạn phải chú ý tới những cử chỉ rất là nhỏ nhặt của bệnh nhân của mình. Tôi nói ví dụ, người phụ nữ châu Á khi nói về những vấn đề cá nhân, vấn đề về sản khoa sẽ ngại hơn là người Mỹ, đặc biệt là người Việt Nam của chúng ta. Thành ra quý vị, bạn phải có một cái cách nhìn rộng, cách nhìn mở hơn và hỏi và lắng nghe họ. Luôn luôn khi khám bệnh sản phụ khoa, luôn luôn phải có một người khác trong phòng khám chung với bạn, và thường là nữ y tá hoặc là nữ trợ lý. Bất kỳ lý do nào phải có người, tại vì khi mà bạn ra tòa, luật sư câu hỏi đầu tiên của bạn là bạn làm gì với bệnh nhân lúc đó, và nếu như không có ai ở trong phòng để làm chứng cho bạn thì bạn rất là khó để giải thích với quan tòa và bệnh nhân là bạn đang làm cái gì. Bây giờ chúng ta nói chi tiết hơn một tí xíu về sản khoa và phụ khoa. Thì trong sản khoa, một trong những chi tiết quan trọng nhất là số lần có thai, hay chúng ta còn gọi là gravidity. Đây là số lần mà người phụ nữ từng có thai. Và con số thứ hai là pregnancy. Tôi nói trên là số lần người phụ nữ từng sinh, có thể là sinh non, sinh chết, đứa bé sinh lúc chết, hoặc là bất kỳ lý do nào, nhưng mà deliver là cái key đây. Và trong sản, cái quan trọng nhất là cái ngày sinh, ước lượng ngày sinh, estimate delivery date, rất là quan trọng. Và cái cuối cùng là khi bạn nói chuyện với bệnh nhân trong sản phụ khoa, nếu như sản phụ khoa bệnh nhân có thêm người thân, ví dụ chồng, bạn trai hay bạn gái, bạn nên hỏi ý kiến của họ trước khi bạn đi sâu hơn vào vấn đề. Tôi ví dụ như cô John, đây là chồng của cô có phải không, hoặc là hãy để họ giới thiệu đây là ai. Và trong trường hợp đó bạn sẽ hỏi là như vậy thì tôi có thể nói chuyện về trường hợp của cô trước mặt của chồng của cô có được hay không, và khi bệnh nhân đồng ý thì bạn sẽ tiếp tục. Và nhớ là sau khi cuộc nói chuyện hoặc là khám bệnh xong, bạn phải ghi xuống take notes for everything, what happened, because some days when the court or whoever sue you, you have documentation that proven what you have done that day. And good luck with this module. I hope you enjoyed and see you in class. Thank you.